every day. I always try to remind myself of that, to not get too comfortable with things. So I'm going to fly through these slides pretty fast, but this is Nairobi down here, and we went past the Rift Valley to Tenwood Hospital, and that's what the hospital looked like at a central courtyard. Iguanas. My 2-year-old daughter and my wife went with me, and I think that that's important to expose your kids at a young age. My daughter will be going to Brazil with me in a few weeks. They had a casualty room, which is basically their emergency room, and that's what this is a picture of. What I like to talk about in that is I always would walk in and shut all the windows, because every night we'd see malarial meningitis, or patients with just your standard malaria. And the Kenyans would giggle at me, and I'd say, no, I don't want them biting the patient, they're biting me. But anyways, this is a wound injury. Y'all can see it. The skull is fractured like an egg. So somebody took that club and took it to somebody's head. This is a pongo injury. We saw a lot of these. This is a girl that I think she got in a fight with her husband. And like I said, children and women, they're the ones that get hit the hardest. And so she was sliced across the face. I should have taken an after picture after I stitched her face up. Cutaneous anthrax. Y'all heard about anthrax in the news a while back. Thankfully, this is not the kind that bioterrorists are involved in. Her family, the cow got sick. They said, so we're going to kill the cow. We're not going to eat the meat, but we're going to keep the hide. And so she was sleeping on the hide and got the cutaneous anthrax. The wards were wide open, and usually, sometimes we'd see 2 people to a bed. They put the head on one end and the head on the other. The problem with that is sometimes they wouldn't be very smart about it. I tell this story often where they would put, one day I walked in, they had a lady with miliary tuberculosis, which is advanced TB, and hyperemesis gravidum, which y'all know is pregnant women that are vomiting a lot. So they had them in the same bed. This is a common vitamin deficiency we used to see in South Carolina a lot. It gives you diarrhea, gives you delirium, so she was kind of not very lucid. And it causes dermatitis rash, and eventually it kills you. And her diet consisted only of corn. And we don't see that much in South Carolina anymore, so people living doing that. One thing that you have, when we were talking before this meeting, I was talking with a few students about culture, and I recommend, it's so important that you align yourselves with the culture before you go. And every day they would stop and they'd have chai, which was just basically sweet tea at 10, 2, 5, 8, 3. The only problem with this is that the Americans would never stop, for one. And number 2, sometimes my patients would be dying, and I'd say, well, where's the nurse? Well, they're having chai. They're warming up the chai. So you definitely have a different culture that you enter into, with different mores.
I have another question. Why would they do that?
It's just, it was important to them to stop and have their chai. And they were people died all the time. So just kind of, not that they didn't care, but people die, They just kind of shrug their shoulders. It's almost, you'll find in those cultures, it's very fatalistic sometimes. So this is tuberculosis. You can see a nice big cavity right there. Eggnog. That was outside the pediatric ward, my wife and my daughter. A lot of AIDS, a lot of AIDS, a lot of AIDS. And so this is an interesting slide. Hard for y'all to see, but you can actually see the loops of bowel through the abdominal cavity because the muscle is wasted away so much. This little kid had congestive heart failure, which we usually just see in the adults here in the States, but he had rheumatic heart disease, untreated sore throat. They always made fun of me about the under 2 ward. That's always that picture previously, because the windows were left open, and the under 2 kids were all there for diarrhea, and so it was a ranked ward to enter into. But because the windows were open, all the flies liked it too. So you'd be doing rounds and flies crawling all over you, and they would giggle at me because I was a funny American. I'd be doing this the whole time because I hated flies on me. And I also would wash my hands. They said, "You have OCD, don't you?" We've never seen that before. So. This kid, a hyena came into his village and bit his leg and drug him through the village and eventually let him go. This is his father, who's a Maasai. Maasais don't let you take their picture because you're going to steal their soul. But he didn't care because he was a Christian. He said, "Take my picture." In the nursery, they just piled babies up. This baby had a lot of congenital malformations. This baby had tetanus, and the way the baby got tetanus is that families did not deliver babies in the hospital unless there was a problem. So this baby was delivered at home, as was normally done, but they cut the umbilical cord probably with a dirty knife. And so the baby was on Valium for 2 or 3 months. I was still there when I left. This is a baby I resuscitated, but they died later on. A big head, lots of cerebral spinal fluid. A lot of neural tube defects, which we don't see much anymore because the pregnant women in the States eat bread, and the bread has folic acid in it. And folic acid helps prevent this. I love this picture. This mom loved her baby. You can see the baby didn't have eyes. She just loved her baby regardless of what it looked like. Community health is real important. And no matter where you go, they would go out and talk to the women underneath the trees and tell them about vaccinations and such. They would build water filters out of concrete and sand. We got to visit our friend's house. There are stoves. The reason why the kids got burned, you saw that previous picture, is because the kids would fall inside the stove, the oven, or the mud ovens. My friend built this house out of mud. This was his bachelor pad. That's outside church. If you are white, you need to preach. That's us outside of a grass home. I always love that sign. Let us go inside the cage of a cheetah, and it purred just like a cat. That's us on our way back. Got any questions about that? Yeah.
Can we go back briefly to the ethical debate you were talking about?
Yeah.
None of us are going to go to Costa Rica or any of these places that we're going to with a medical degree, so how do we approach those situations where someone is saying, here, resuscitate this baby? Like, what if it's a situation of us either resuscitating it or it dies? Like,
so that's a great question. So before I went to, my friend, who was also a medical student, who was interested in surgery, went and I think he even did some surgeries on his own. But anyways, so he and I were talking about it. I'm like, I'm not comfortable with what you just said. I don't think that's right. And he said, well, listen, it's me or nothing. And that's what made it work for him. So I think if you're in a situation where somebody in the States, where somebody crashes their car and you're a good Samaritan, so you stop your car and gosh, they're not breathing, so you do CPR. Well, you didn't really learn CPR. You're really certified right now. But you do it regardless when you save the person's life, or maybe you don't, maybe they die. But at least you try. So I think under the Good Samaritan law in the States, you're covered. Outside of the States, the Good Samaritan law does not apply. And so there is some legal issues that are brought up. But there's never been a malpractice suit. That's how I answered my friend who called me. That has been surveyed and questioned before. So it's a good question.
what are some things that we should try to stay away from? Like, if it's not a life or death situation, giving vaccines and stuff, these are things that have been, and pulling teeth was one of the debates going around with dental schools and stuff.
I think that hopefully you'll be with you mentioned you'd be at the local physicians, mm-hmm. and so you can, we definitely shouldn't do anything you're not trained to do, but also ask them if this is right for you to do it, meaning this is something that I should be doing in your country. You can always defer to them and ask them, but even beyond that, it's helpful to have people, Dr. Smith, around and say, listen, should we be doing this? Because you'll be put in those circumstances. But it's a hard question. Pulling teeth probably is no big deal. Giving immunizations, probably it's okay too. But you have to weigh it out. Because you're right. People that are pre-meds, when I was a pre-med student, I did a lot of things I probably shouldn't have done, and as well as a medical student. Just because nobody was mentoring or telling me, listen, you shouldn't be doing this. And it puts you in a bad place. There's been a lot of things that happen. One story I like to tell is that babies sometimes when they're born will come out in distress. And so in the States we're really aware of this, and so when we're called to delivery, we get ready. And if there's any sign of distress, we're ready to resuscitate the baby. There's a thing called neonatal resuscitation protocols, NRP, and so we're taught how to do that. Well, as a medical student, I hadn't been taught how to do that stuff. I just read about it in books. And as a med student, I had attended a few deliveries, but never ran it. Well, I showed up at a delivery, and there's a thing called meconium, which is basically baby poop. So sometimes when babies are in distress, they'll poop. And we'll give them some amniotic fluid, and if they aspirate it or try to breathe it in, it can cause inflammation in the lungs. And so in deliveries, the protocol's changed a little bit, but in deliveries, you're asked, if the baby comes out and there's any sign of meconium aspiration and the baby's not breathing, you're supposed to suck it out before you do anything else. Suck it out really, really good and get all that poop out of their lungs, for lack of a better word. And so I was called to delivery, and nobody arrived, just the fourth-year medical student. And eventually, so I was setting up this equipment as best as I knew, and eventually I did have a doctor kind of come behind me, a family doctor, who was not a pediatrician, not really trained to do it either, but the pediatrician was on vacation. So anyway, so the baby comes out, and I'm resuscitating the baby and trying to suck out the meconium, and because the baby didn't have that, and didn't get any meconium. He said, "Well, just go ahead and intubate, and we'll let the baby breathe." Well, I looked down at the equipment, and the meconium aspirator flipped. I had it backwards. But I hadn't been trained how to do it. But I didn't realize that, so I flipped it around and then sucked out, and I got all kinds of meconium back. But we'd already helped the baby breathe a lot. Well, I was bothered by that, obviously, because it was done wrong. But the baby survived the delivery. And so we took the baby to the nursery, and we gave the baby oxygen. We always had to decide, Dr. Smith and I have talked about this before, had to decide which baby got the oxygen machine, because there was only one. Sometimes babies would die based upon your decision. And over the next few days, that baby's breathing got worse and worse and worse. So I basically heard that baby suffocate to death over 3 or 4 days. And eventually the baby died. And so I had major issues with that, because here I am, I at least thought that I contributed to the death. And so I asked that doctor, he said, "Well, you do what you can do." He'd been doing this for a lot of years, but he didn't really make me feel any better about it. The evidence shows now that all those fancy protocols and stuff probably don't make a difference. The baby probably aspirated the meconium in the baby's womb. So the damage had already been done. But at the time, when I made those mistakes, because I didn't have any training, at the time it was suggested that if you didn't do it that way, you were basically damaging the baby's lungs. I probably didn't help the situation out by helping the baby breathe with meconium. So you will be put in circumstances where it's better to say what I've learned through residency is to declare it. Say, "Listen, I don't know this, and somebody else needs to be doing this." That doctor should have been doing that for resuscitation, not me. And he should have stepped aside and said, "Listen, you're a med student. You're not supposed to be doing this." He was kind of supervising, but anyways. So yeah, you have to be careful. Protect yourself in that regards. So. All right. Any more questions? You all want me to show you pictures of Brazil, or stop now? What would you prefer? Okay, just tell me. We'll go quick through these two. So we go to a place called Fortaleza. Fortaleza is up here on the northeast. It's a coastal town. And Fortaleza is a nice big city. Brazil is a developed country. So their mall looks like our mall, the roads, you can go to their Pizza Hut. So people ask, why do you go to Brazil? And I'll show you why. It's because they have they have favelas. They have a lot of street children there. And you'll see when you're riding on the roads, they have glass on the walls to keep kids from climbing over and stealing stuff out of the trash. This is a favela. Favela is a slum. They put tons and tons of people in these favelas that are poor. And they live 10 minutes away from the normal city. This is us walking through the favela. This is my interpreter, Carla. I told you all about her a couple minutes ago, or before. We were walking down this pathway here. Andrew, who is from England, said, "This is where everybody does their drugs at night. They inject drugs." Beautiful street children. Andrew came from England because he had a heart for street children. And that's why he's there. Remember, kids and women, particularly children. And so he's making a big difference there. She works in an orphanage. I'll show you all pictures in a second. When we were there, they were constructing a door with a lock on it so this kid wouldn't sneak out at night and deal drugs. His mom couldn't keep him in the house. So they asked him to build a door with a lock on it so she could lock him in his room at night. The orphanage makes a big difference there. This is us at the orphanage. These are kids that have been rescued from the favelas. And there's the people that run it. The orphans will make bread and sell it and help support the orphanage that way. Cashews are a big crop there.